Hi everyone, my name is Sarah Murphy, and today we are going to be looking at different diseases of the respiratory tract, specifically 3 different types of chest infections or pneumonias. Um, Before we begin, I just want to say with any words from science, they can be very hard to pronounce. To where I googled how to pronounce some of these words, so if I butcher them, just ignore me. I'm doing the best I can with some of these words. Um, Also, I didn't put too many words on the actual slides themselves. I figured that I would just more so vocalize the important parts of what you should know instead of just like throwing a ton of words that you have to read and like try to follow along with. So just important to just like pay attention to like what I'm actually saying versus what's on the slides. Okay, let's begin. Diseases of the respiratory tract are illnesses that affect components of the respiratory system, including the nasal passages, the bronchi, and the lungs. And there are 2 different types of respiratory tract diseases. They can be infectious or chronic. Infections are commonly bacterial or viral. In the viral type, a pathogen replicates inside of a cell and causes a disease. And with treatment, you can typically get it to go away. For example, the flu. Whereas a chronic disease happens when the disease is persistent and long-lasting, where the patient can go for a period of time with having no symptoms, and then a couple months down the road, they end up having symptoms come up again. For example, asthma would be one of these types. There are 2 different parts of the respiratory tract, the upper and the lower. The upper typically includes the nose, the nostrils, the nasal cavity, the mouth, throat, and the voice box. But for our focus today, we're going to be focusing on the lower respiratory tract, which typically includes the trachea, the bronchi, the bronchioles, and the alveoli, which make up the lungs. Because the pneumonias we're looking at do affect the lungs. Like I said, infections of this region are primarily lungs or voice box, and the 3 types of diseases we're looking at today are pneumococcal pneumonia, Linger's disease, and Pseudomonas pneumonia. Okay, getting into it. Pneumococcal pneumonia is caused by a bacteria called Streptococcus pneumoniae. It comes from the domain bacteria, and like I said, it's the causative agent to pneumococcal pneumonia. Now, the Streptococcus pneumoniae can cause different diseases like ear infections, infections of the brain membranes. But however, we are looking at what it does to the lungs when the lungs become infected. Streptococcus pneumoniae frequently colonize the nasopharynx from the nasopharynx. It then spreads to different parts of the body. For the purpose of this presentation, we'll be talking about pneumococcal pneumonia. Pneumococcus is a highly invasive gram-positive extracellular pathogen that can survive in both aerobic and anaerobic conditions. If you hear growling, I'm so sorry. I have a dog in the background. It's spread through contact with people who are ill or who carry the bacteria in their throat. It is estimated that about 4 million illnesses and around 450 hospitalizations per year are caused from the Streptococcus pneumoniae bacteria. The bacteria enters through the nasal cavity and then attaches to the nasopharynx epithelial cells, and they colonize. If the bacterium is not cleared by the immune system, the bacterium is then spread via horizontal dissemination to the bronchi down to the lungs and becomes pathogenic. And this is where your issues start arising. Pneumococcus is an opportunistic pathogen that takes advantage of hosts with underdeveloped, weakened, or deteriorating immune systems. Because of this, Streptococcus pneumonia has greater incidence in children under the age of 2, the immunocompromised, and the elderly. Let's see, the virulence factors, like other bacterial species, it produces toxins that are harmful to its hosts, has several proteins and physical structures which play a vital role in its pathogenesis. These factors work by hindering the host's immune response, avoiding defense mechanisms, or by direct contact with the host tissues and surface receptors, which in turn interferes with the host's immune system activation and bacterial clearance. Its virulence thrives because of the bacteria's ability to acquire new genetic material via transformation and recombination. And pneumococcal pneumonia, fever and chills, cough, rapid breathing, difficulty breathing, chest pain. So they're going to have this is Legiera's disease, which is caused by the Legionella pneumophila, which is a genus of aerobic pathogen, gram-negative, non-spore-forming, rod-shaped bacteria. They are found naturally in freshwater environments like lakes and streams, and they are dangerous when they're spread from human-made building water systems. These human-made building water systems can include shower heads, sinks, faucets, cooling towers, hot tubs, decorative fountains, water features, hot water tanks, heaters, large complex plumbing systems. And most people become infected when they inhale microscopic water droplets containing the bacteria. A few people have even developed the disease after working in a garden or using contaminated potting soil, because it does thrive in environments with like in soiled areas. It possesses many of the traditional virulence factors as other bacteria, such as flagella, pili, and other outer membrane proteins. It usually spreads and grows in human-made water systems, and it can spread through droplets small enough for people to breathe in. The bacteria binds to the respiratory epithelial cells and then macrophages into the cell. Once it has entered the cell, it inhibits phagosome-lysosome fusion, thereby promoting its proliferation, and that is how people can get Legiera's disease from this. And usually the onset would be 2 to 10 days, or it could be up to 20 days. It just depends. After being exposed, usually it's like 0.1 to 0.5 did people get this disease. So it's not like really common, but it definitely does happen. In terms of symptoms, the symptoms typically include those similar to other types of pneumonia, which include headache, muscle aches, fever that can reach up to 104 or even higher. By the second or third day with this, you'll have other symptoms, which can include cough, which will bring up blood and mucus, shortness of breath, chest pain, nausea, vomiting, and diarrhea, or even confusion or other mental changes. To diagnose this, doctors usually do like a chest x-ray similar to the other pneumococcal pneumonia that we talked about, or they even do urine tests, which the urinary antigen test detects molecules of Legionella bacteria in the urine, or other lab tests that involve taking a sample of phlegm or washing it from the lung. I also saw that they do a PCR test, which is a polymerase chain reaction test, in which the DNA can be amplified and identified more easily. The advantage of doing this is that it can detect all species and serogroups from the Legionella family. So you're gonna find it. Treatment typically includes antibiotics, and obviously the sooner therapy is started, the less likely the chance of developing serious complications is. Sometimes treatment even requires hospitalizations, and there's really like there's no vaccine yet. And it's not very hard to treat. I mean, people that get the antibiotic, most cases of illnesses can be treated successfully. Healthy people usually get better after being sick with Legiera's disease, but they often do need hospital care. Possible complications are lung failure and, of course, death. And about 1 in 10 people who get sick with the disease will die due to complications from their illness. For those who get it during a stay in a healthcare facility, because of it like thriving in these like moist environments where, of course, healthcare facilities are, 1 in 4 will die. But I did say that it can be treated, and it can. It just depends on the state of your immune system. If you have a compromised immune system, you're more likely to struggle with getting better. And prevention, because I did say there wasn't a vaccine, but things can still be done. The CDC developed a toolkit to help building owners and managers develop and implement a water management program, just so they're like taking precautions to make sure that their water is not contaminated, and if it is, it doesn't spread and they can get it taken care of quick. And those that are at increased risk are people 50 or older, current or former smokers, people with chronic lung disease, people with weakened immune systems, or people who take drugs that weaken their immune system. Okay, and the last one we're looking at is Pseudomonas pneumonia, which is caused by the Pseudomonas bacteria, which is a gram-negative, non-fermenting aerobic bacilli. It is feared for those with weakened immune systems because it can be deadly, of course. It's usually found in moist environments like soil, water, and vegetation, and can be isolated from the skin, throat, and stool of healthy persons. They typically colonize in hospital food, sinks, taps, tops, and respiratory equipment. It is spread from patient to patient via contact with someone who has ingested contaminated food or water. The germ can be spread directly or indirectly. Directly meaning like through things like kissing, and indirectly through touching a contaminated item. It can affect the blood, ears, eyes, but our concern today is with the lungs because that's where the Pseudomonas pneumonia is going to happen. It's not very common, but it will require hospitalization. It is commonly acquired in the ICU because of how the organism flourishes in moist environments, and it's even sometimes called the ventilator-associated pneumonia because people get it so often from being on a ventilator or using nebulizers and using respiratory equipment. It is typically seen in patients who have pre-existing lung disease, chronic heart failure, or AIDS, and is usually the result of aspiration of the respiratory tract secretions. Symptoms include ear pain, skin rash, same symptoms. They're just different types of pneumonia. Those at risk include people with weakened immune systems, and again, it is an opportunistic disease, which means that the organism only causes the disease when the person's immune system is already impaired. Increased risk of infection can be increased with burn wounds, receiving chemo, cystic fibrosis, or having HIV and AIDS. In healthy individuals, they can still get it, but the symptoms would be very mild, like a skin rash or an ear infection. And of course, people at risk would be people on breathing machines, people using catheters, or with wounds, like I said before. You can avoid getting infected through patients and caregivers can work together to do this by keeping their hands clean to avoid getting sick and spreading germs that can cause infections, like by washing their hands with soap and water or using alcohol-based hand sanitizer, particularly before and after caring for wounds or touching a medical device. It is important to remind healthcare providers and caregivers to clean their hands before touching the patient, and also by allowing healthcare staff to clean their rooms daily when in a healthcare setting. Honestly, maybe even do it after each patient, just to ensure that you're getting all the unhealthy bacteria out of the room. Healthcare facilities should also have water management plans that ensure water quality and reduce the risk of exposure to potentially harmful germs like the Pseudomonas bacteria, kind of similar to the Lee Jarries disease like health plan the CDC put out. But yeah, that's it. I mean, one other thing I can say about the Pseudomonas disease, pneumonia, is you can also avoid hot tubs and swimming pools that are not cared for because they thrive in the gross water systems per se. But other than that, that is it. If you have any questions on any of the diseases I just discussed, just let me know. And yeah, I'll get back to you. Thank you so much.